in men and women?
Okay, mostly nowadays in Kenya and globally we have different types of cancers, but we'll narrow down to Kenya mostly, because let's talk about Kenya first before globally.
Yes.
We don't have, we have mostly for the ladies, we have breast and cervical cancers, whereby cervical is the most leading deaths in mostly for the ladies in Kenya. And for men, we have colorectal, we have esophageal, and we have prostate cancers, the most common types of cancers in Kenya and even globally. Yeah.
And I was doing some research and I saw a story whereby a lady was diagnosed with cancer at the age of 23.
Yeah.
When you talk about cancer, what is some of the things that we need? Do we say that at the age of 23 or even before by 16, because that's when you see like countries like America at the age of 16 or even 60 sometimes. When are we supposed to go for screening, first of all?
Screening is, it depends. If you have, let me say, a family history. When you have a family history, you can go for screening as early as possible, depending with the genes that you have in the family. And then at the same time, we can't say like we have a specific age for the cancers. Nowadays, we are having even the age of 3, we are having leukemias, mostly for the kids, and even the age of even 5, even 60. So we don't have a specific age for people to get CAs. And for screening, mostly if it's for the first degree family members, that's first degree mean maybe father, mother, and their kids. And then we usually say if it's for, depending with the type of cancers, we can go for, if it's colorectal or esophageal, we usually advise people to go maybe from the age of 45 and above for that screening. Yeah.
All right, and you were able to, allow me to take you back some few minutes ago, you were able to maybe point out some different types of cancer that we have, that is for both the men and women. And could you kindly tell us more about breast cancer in women? Okay.
Breast cancer mostly, we can't say it's only in women. Now it's affecting even men. So it's all about it's a hormonal thing. Because we usually say if maybe your parents had breast cancer before, maybe the great-grandparents, we should advise people to go for screening for mammogram and for physical examination, those things. So, and maybe after that, like in our facility, like St. Mary's Mission Hospital, the mighty St. Mary's Mission Hospital, we usually start from self-examination, that was SBE, self breast examination, then we come to clinical breast examination, whereby the clinician usually examines you. And then after that, maybe you can take a biopsy. After the results are out, if it's positive or positive, we usually go for either chemotherapy or radiotherapy. And if it's negative, we will advise you on the way forward. So let me say, generally, breast cancer is more of a hormonal thing. And then I think what I'm happy with is that we usually say, like breast cancer is something that is curable. If detected early, it's something that you can cure. And then I have a testimony from my friend, a very good friend of mine working somewhere. She was diagnosed of breast cancer when she was 28 years old. For now, she's cancer-free. Wow. So we can say like breast cancer is something that's curable. Yeah, and then when you come to St. Mary's Mission Hospital, it's something that we are going to work together, journey together, and then at the end of the day, you are going to smile a lot. Yeah.
All right, thank you very much. It's good to know that. I think it's very important for one to visit the hospital once in a while, just to have a normal checkup, you know.
Exactly.
And especially for St. Mary's Mission Hospital, I understand you do have a different reach out programs whereby you have free medical camps that you can be able to maybe enjoy various medical, camps that you offer and facilities that is at St. Mary's Mission Hospital in Langata. Yeah. Let's talk about risk factors of this cancer. You were able to point out some different cancer. That is for cervical cancer, we have breast cancer, there is prostate cancer. Kindly break down the risk factors.
So for now, we don't have a specific, but we usually say everything's about the risks. So if we narrow down, we usually categorize risk factors differently. We can say environmental, we have in terms of infection, we have in terms of genetics. So when we talk about the risk factors, mostly it depends with the type of cancer you're supposed to have. So when we talk about risk, we can have sedentary lifestyles. Those are what we can change, behavioral changes. But about the risk factor, we can talk about infection, whereby you avoid, okay, sorry to say, about the multiple partners someone should have. That's where we can also going to protect and prevent most of the C of the cervix. And when we talk about the prostate cancer, we usually say like risk factors more of age, most of the age, but of course we can't avoid the aging process. So most of the risk factors is mostly obesity. We usually advise people to go for the checkup, like in mostly sentiments. Also, we have a nutritionist who's going to guide you, take you through the let me say the BMI, okay, the obesity in terms of the weight.
Yeah.
So our nutrition is going to guide you the way forward and the normal weight someone is going to have. So apart from the weight, we can have environmental factors, whereby we usually advise people to avoid scorching sun. Mostly they can expose you to types of cancer of the skin. And mostly for the infection, we have told you, you can avoid it in terms of when having multiple sexual partners. For those people who are sexually active, it will protect you and prevent you from getting HPV, human papilloma virus, which is going to expose you to cervical cancer. And for the colorectal or esophageal cancers, usually we have the risk factors of injection of hot meals. Mostly the people, the study that has been done, those people from the western part and those people from the northeastern and the eastern part, most of them, they usually come in with esophageal cancers. So we usually advise them to avoid injecting of taking food which is hot, because it's going to to alter the DNA system, the normal mucosa of the GIT. Yeah.
And it's very interesting that you touched about taking hot, beverages or even food, and especially during cold season. People love to have, hot coffee in the tables. When you say hot, how hot should be that hot?
we can't quantify. We say like this is quantify, like if this is very hot or something of the kind of the temperatures, but we shall advise people to take just warm, not hot. Yes.
Okay, and we shall be coming to demystify some of the myths surrounding this cancer, because I understand there's a lot of conversation that goes on when it comes to cancer, and especially that you were able to mention and point out taking hot stuffs. And let's talk about some of the signs and symptoms that people should never ignore when it comes to cancer.
Okay, we don't have a specific signs and symptoms, but mostly for the people who are having, depending with the type of cancers, if it's mostly, if we're starting from prostate cancers for the men, usually single out something like anuria, or maybe difficulty in terms of passing out urine, or maybe in terms of the normal way. Of course, okay, when you are a kid, used to maybe to have the normal way of passing out urine. But now when you are old, or maybe let me say 45 years and above, and then you experience maybe the urgency of passing out urine is not even going out truly everything. That's another sign. And then for the people who have esophageal cancers, mostly they usually have unexplained weight loss, and then dysphagia, whereby you have difficulty in terms of taking in food, and then mostly you become emaciated with losing weight and unintentional, something that's not you have not gone for it, but mostly you just lose weight. And then after that, when you go to colorectal cancers, mostly we have around four types. Here we usually talk about the weight loss. We usually talk about blood in stool. Mostly we usually talk about the normal, of course, the normal stool way, but mostly people usually pass about pellets in terms of goat pellets of the kind. So such things. And then we talk about the breast cancers. We should talk about the risk, the signs and symptoms of it changes the skin of the breast, whereby you usually have what we call okay, there's some change of color. Most of the breast is affected, and then when you check on the maybe on the mirror, you usually check the size, the other breast which is not affected, and the one that's affected, the color has changed. And most of the cervical cancer, we usually check of the smell, and the that's where we usually tell people to go for checkup, mostly in terms of cervical CS. Yeah.
Okay, and talking about breast cancer, I understand there's a way you can be able to examine yourself, and it's you mentioned during some few minutes ago about men can also have breast cancer. When it comes to women, I know there's a way and a process that you're supposed to do. What about for men?
It's the same way.
It's the same way.
It's the same way. But of course, men, sorry to say, for men, we don't have such a burst in a way.
Yes.
But you will experience maybe a lump and of the kind, but it starts maybe swelling in a way. And then, of course, you just notice maybe the change of the color. Maybe the nipple just maybe changing, and then we usually tell people the normal way of escalating, of checking the breast way. And then after that, if you see like you can't make it, you usually advise people to go for the clinician checkup. Yeah, whereby in St. Mary's, we offer that.
You have all the services.
Yeah.
Okay, and let's talk about the cervical cancer. You talked about the smell, and sometimes you may find, especially for the ladies, sometimes a smell may vary. And you talk about fish kind of a smell. There's so much that goes on with women. What kind of a smell should people, start paying attention, and especially to be very specific when it comes to women? Okay,
of course we don't rely on the smell, but also can rely also on the discharge. Because also the discharge matters, because the smell can be even candidiasis, the normal way, fungal infection.
Yeah.
Mostly because of maybe the medication, or maybe because of the change of the environment of the staff. But for the CS, the smell is distinct, mostly fishy smell, and the discharge comes out maybe yellow, others they come out red, so depending on the person. That's why we should tell people, if you experience such a change of smell, because you know yourself, like you usually know the normal way of your cervical, maybe this in terms of menstruation or something. So when the change has happened or it has occurred, just to go and get checked. Yeah.
And how long would you observe yourself for that? Maybe
mostly for the fungal infection, we usually say it just clears maybe in a period of 0 to 14 days. If maybe with medication, but if it persists and then the smell continues, maybe blood out comes out or something of the kind, just go for the checkup as early as possible. Yeah.
Okay, well, I'm very happy to have you here and to engage with this conversation and to share this information to our viewers by creating awareness. And thanks to St. Mary's Mission Hospital once again. You were able to mention during the conversation, and I was very excited to have these a specific question about the myths surrounding this cancer. As you mentioned, because I know so many people argue, when it comes to warming food on the microwave, you're not supposed to use, I don't know, plastic cups. You're not supposed to take like warm or even hot things on the plastic cups. It can cause cancer. Being an oncology, please tell us more about these.
Those are myths. Of course, we can say like it's about 0.00 something that can cause cancer. Others they usually say if you go for an X-ray, maybe for a checkup, maybe you have got a fracture of the leg or something. You go for an X-ray, you are going to get cancer. Those are another myth. Others people tell people mostly from some region. Let me not even mention about the regions. She will tell you like that is witchcraft. Your neighbor or maybe your great grandfather has bewitched you. But I don't think cancer is cancer. Cancer is not a myth. And then cancer is just a disease. And then we can't say, if you have not something that is so abnormal to your body, just don't assume. That's why even now, the government of Kenya has tried to engage people, most of the healthcare workers, and even it has tried to build a lot of facilities, even to the local regions, so that people can at least try to access the care. So means mostly it's about the microwaves, it's about the X-rays, it's about the neighbor, it's about the great-grandparents, and then others, even after the diagnosis, maybe the result, the histology results has come out to be positive, like it's a cancer. Others, they don't even believe it. They usually go like, let's go for that. Mzee wa nyumbani. They usually say mzee wa nyumbani, ama yule mwenga wa nyumbani, go just check from that person. So they usually give you mitishamba or the kind. And after that, when it deteriorates, that's when you go back to the hospital like, hey, doctor, for now, I think when we went home, social factors, maybe economic factors, it was a challenge. Now we are here back. But you say by then, maybe he or she's back, the cancer's metastasized. And then we try our best, of course, palliatively, mostly in our facility, usually try to incorporate everything, despite you going away and then back. We should try to incorporate together, we work join together despite of everything. But maybe at the end of the day, it might be too late. Yeah.
All right, and thank you for sharing that, because some of us have been in trouble with our parents when they find you warming, our food with microwave, with using plastic cups and plates. Sometimes they say you have to maybe cover the food. Is it true?
No, okay, you can cover depending, but covering or not covering doesn't affect.
It doesn't affect.
Yeah, it doesn't. Maybe 0.00 something, which is almost to zero. Yeah. Because if it was, then definitely most people from the West, they should be having a lot of cancer. Yeah.
And I'm sure some viewers can be able to resonate with that conversation. Thank you all so much. And with that, I think we're going to take a very short break here on our Health Corner show. But when we come back, we shall continue with a conversation here that is general cancer awareness. And of course, we are reflecting our conversation on the World Cancer Day that was, celebrated by creating awareness on 4th February. So in case you have any questions to our guest here with me, please do share with us, and we shall be reading your comments and questions after the break. But before that, stay tuned for our second part on the lifestyle choices, and of course, when can maybe people go for screening. All right, let's take a very short break. We'll be right back. Stay tuned for that.
Enjoy this conversation with me, Maureen Kimani, every Friday from 9 a.m. on our Health Corner show here at Capuchin TV. Your health is your wealth. Feeling unwell, seeking expert medical care that prioritizes both your health and well-being? Welcome to St. Mary's Mission Hospital, Langata, where compassionate care meets cutting-edge medicine. At St. Mary's, we believe in providing holistic health care. Our dedicated team of healthcare professionals is committed to delivering personalized care to each and every patient. Nestled in the heart of Langata, our hospital offers a peaceful and healing environment for patients to recover and thrive.
We have masses every day, weekdays at 6:30 a.m. in the morning, and also in the evening at 6:30 p.m.
Your health is our top priority. Experience the difference with compassionate care you can trust. Whether you're in need of routine medical care, specialized treatment, or emergency services, St. Mary's Mission Hospital, Langata is here for you. We offer a comprehensive range of services including outpatient, inpatient services, laboratory services, comprehensive care clinic, and fertility, ophthalmology, pharmacy services, radiology and sonography, dental services, pediatrics, physiotherapy, ICU and HDU services, dialysis.
Here we do dialysis for kidney failed patients, and we do it from Monday through Saturday. We welcome you all. We accept all insurances and cards.
Clinics and CT scan services. Experience your health difference with us. Visit us at Langata or our branches in Nairobi at Cardinal OTUNGA PLAZA and in Rift Valley, Elementaita, Nakuru County. For more information, contact us at 0797 972 794 or 0769 781 880 or 0717 305 204 or email us at info@stmarysmissionhospital.co.ke. St. Mary's Mission Hospital, Langata. Compassionate in healthcare. Enjoy this conversation with me, Maureen Kimani, every Friday from 9 a.m. on our Health Corner show here at Capuchin TV. Your health is your wealth.
Welcome back, dear viewer, to our Health Corner show right here on Capuchin. And in the studio, I'm being joined by Constantine Matebe, who is an oncology nurse from St. Mary's Mission Hospital, who is helping us to understand more about our today's conversation, that is cancer, and shedding more light on how well and just to help us understand when can we visit this facility and how can we able to examine ourselves in terms of cervical cancer and of course breast cancer is concerned. And before we had gone for the break, I had mentioned in case you have any question that you would love him to respond to us, you can definitely reach out. And I can see we have one question here from Scholastica Matebe. Thank you very much, Scholastica. And you're saying, good morning. Can someone, this question goes to you, Constantine. Welcome back to our second part.
Thank you.
Yes, and Scholastica says, good morning. Can someone who has been affected by benign tumor, let's say breast, if cut off, can she get healed forever? And another one, apart from drugs, what causes cancer? And the third question, is it true that cancer antidote has been found? So you can be able to shed more light to Scholastica. And she didn't tell us where she's watching us from, but thank you very much for tuning into our conversation.
Those are tough questions anyway. Thank you, Scholastica, for asking that. I think I'm very sure we haven't got an antidote really about cancers, but mostly we have vaccines of mostly cervical cancers, whereby you can walk in. Mostly in we have in St. Mary's we have 2, and then you go to Cambridge offices, you can have 1. You go to Kenyatta, you can have another injection vaccines for cervical cancers. It doesn't matter about the age, but most usually say from 0 to 24 years old you can get your vaccines. But for now they have come up also with another one up to 45 years you can get your vaccine for cervical CAs. So about asking about benign, yeah, benign is not something that has that we can quantify and say it's really about cancers. Benign is something that's lagging, just let me say sleeping dogs, they're just there. Yeah. So and then mostly drugs doesn't also cause CA directly. They don't contribute to cancer directly unless indirectly. That's why we usually say we have different factors that can cause CAs, mostly apart from genetics, apart from environmental factors, apart from the sedentary lifestyle, about the food that we usually eat. So it doesn't, drugs doesn't cause CA directly.
Okay.
Yeah.
And then another one was about cutting off. That is it true? Wait, let's say a breast is, if cut off, can it heal forever?
We have treatment modalities about that. Mostly when we do, before even, okay, it depends with cutting off. Mostly I think she's meaning about surgery.
Yes.
We can go mostly before even we engage about surgery nowadays in our facility. Let me say, I think you have really, it's a milestone in St. Mary's. And I think I can advise people to come mostly if you suspect to have anything. So back to the question, we can, before we go in for surgery, we usually have an MDT, whereby we are going to talk about your type of maybe a suspicious thing in your breast or anywhere else. For her, she's asking mostly about cancer of the breast. When you have done surgery, we go in for chemotherapy, and others usually go in for radiotherapy. And for now, we have even targeted therapy, whereby the chemo we are going to administer is only targeting the cells of the cancer only. So we have really, it's a milestone in terms of cancers and in terms of cancer management. So if you can be cut, it can go forever if it has not metastasized. And if it has metastasized, it can maybe prolong your life for a long period of time, because the chemotherapy is going to alter, and then it's going to cut off that metastasis thing of the CAs. Yeah.
All right. Thank you very much for shedding more light on that. And I think, Scholastica, there you go. You have your answers. Well, as we continue with the conversation, I understand accessing treatment, especially for cancer, can be very challenging. And if you take a look in our country, there's a shift from NHIF to SHA. As St. Mary's Mission Hospital, what are some of the measures that you've put place to ensure that those patients who are cancerous can be able to continue with their medication and clinical maybe visits?
Okay, I'm sorry for this, but the government is really trying so much. That's why I usually see people maybe talking about SHA, others are even protesting about it. But we, as the mighty St. Mary's, I usually call it mighty because it's really assisting people, a lot of people. We, as the mighty St. Mary's Mission Hospital Langata, we went ahead even to the times of this time of, we started from COVID, and then we came here, now SHA and the NHIF thing. We even cut the cost of even consultation. We cut the cost of the consultation for that, so that our patient can even afford. Even in terms of medication, mostly chemotherapies, we went ahead, and then we made to be more available in our facility, whereby the patient not going to tarmac a lot, maybe looking for the medication. We should understand that we have a financial constraint that is so hard, but we are really trying as an institution to make sure everything is available. And then when you come into our facility at St. Mary's, our department is somewhere in the hospital, so that we can give you the best care that we are supposed to give to people, and so that you can feel you are at home. So when you come, you just maybe walk into St. Mary's and you want maybe oncology, oncology services. You are directed to our facility, that's Oncology Center, and then you are going to get your peaceful and home treatment. Yeah.
All right, thank you. And let's now talk about lifestyle choices. As we all know, so many diseases that people get, it's maybe sometimes due to the effect of all lifestyle choices. Can cancer be truly maybe prevented? And what are some of the lifestyle choices that we should observe and make sure that we are not engaging ourselves in too much lifestyle that can maybe expose us to maybe getting diagnosed with cancer?
Okay, cancer, everything is preventable. Even starting from not only cancer, but most of the lifestyle diseases like diabetes, mostly with the hypertension, some that we can prevent. So with cancers, lifestyle choices we can have mostly of, we are from the office, we take our car back to our house. from the house, in our car, back to the office. You don't have such a small, even 30 minutes walk, maybe 30 minutes run. You're not even going to the maybe aerobics exercises. You're just there maybe. So at the end of the day, you gain a lot of weight. And then at the end of the day, it's going to predispose you to maybe cancer. And then our lifestyle choices again is about, when talk about cervical cancers. You know, you have mandated, you have a right to choose maybe one partner. So, but you also have a right to have multiple partners. So if maybe you can understand what the reason as to why HPV is there and it's going maybe to predispose you to CS of the cervix, then you just understand why you should have one partner. You have another thing that's dodging mostly in terms of when you have maybe done the sexual activity and the stuff. So you have a right also to avoid dodging so that you can prevent you from C of the cervix. Our lifestyle changes also depends with environmental factors. You can't maybe expose yourself to the scorching sun and then you say, me nautajua. That's what they usually say, me nautajua. But of course, you have the right also to remain indoors or maybe in the shade or maybe to wear the hat. Yeah.
Okay. And talking about, you know, having multiple partners, there's some maybe cultural traditions that even allow people to have as many wives as you want. So I don't know, maybe as an oncology, how can such families, because there's some friends and even family who have even more than 2 wives.
Yeah, but you see, risk factor is not like is contributing directly.
Okay.
Because we say men are carriers of HPVs, but you usually receive them at the end. So if maybe you have 2, 3, 4, 5, maybe at the end of the day, maybe you may get predisposed to C of the cervix. Yeah.
Okay, wow, this is a very interesting conversation that we are having here, and I'm learning a lot, and of course even to our viewers, I understand you're grasping a lot of information so that you can be able to educate the sisters, the brothers in our community and in churches to ensure that we spread awareness. Talk about focusing on the screening part of it. Is St. Mary's Mission Hospital, do you have any upcoming activities for screening? And you can talk, maybe you can touch about for colon and esophageal, because I understand during our first part conversation we were able to mention about it.
Okay, yeah. Our St. Mary's Mission Hospital facility, we have, for now, for this month, we have 2. We have 2 activities that are going to take place. We have prostate screening, and then we have breast screening that's going to happen this month of February. And then to be precise, I think it will be date 13, and then late February, we're going to have another screening. So in terms of screening, we usually advise people to, mostly in terms of esophageal and colorectal cancers, we usually screen with physical examination. We have imaging like endoscopy, colonoscopy, we have blood works, but for our facility, those is scattered under one roof. So that's why we usually tell people, the viewers who are watching us, and we have a subsidized amount. Like I think we are the cheapest in the whole Kenya. I can testify that in terms of endoscopy and the colonoscopy. So we are very cheap in terms of that. So when it's endoscopy, when you experience maybe some of the signs and symptoms maybe of dysphagia, that's difficult in maybe injecting something out of their food. And then you have like maybe you have lost weight, unexplained, and then maybe you are seeing blood in stool, just walking, fist, and then we have our mighty surgeons, the able surgeons, qualified surgeons, we're going to do, and then we're going to examine you physically. That's a physical examination. We do endoscopy. Endoscopy is through the upper GI, and then we have colonoscopy, that's the lower GI. So we're going to examine you. We are going to see if it's something, a neoplasm, maybe a tumor or something of the kind. We're going to take a biopsy. We are going to take the lab. Then after 2 weeks, the results are going to be back. If they're positive, we start our treatment. If they are negative, we advise on the way forward. Yeah.
Okay, all right. That's why St. Mary's Mission Hospital continues to be mighty.
I think it's mighty. No, don't say just St. Mary's. It's mighty St. Mary's.
Okay, mighty St. Mary's.
Mission Hospital.
Okay, all right. Let's talk about importance of early screening, because you mentioned especially that St. Mary's Mission Hospital, you have some upcoming activities. Why is maybe early screening more important, especially when it comes to improving outcomes for colon and esophageal cancer?
Okay, thank you. The early screening is good in that they say, they have a Swahili proverb that says, samaki mkunja angali mbichi. So we usually say, if something that's going to alter your lifestyle or your life, maybe in the next 30 years, is something you can control right now. So the early screening is going to assist in terms of metastasis. So it's going to assist in terms of the care we are going to get, and it's going to assist in terms of prolonging your life. So the early screening is going to assist you a lot. That's why I usually tell people, and then that's why we have even come up with screening of the prostate and the breast and the cervical CS. Like in that we can counter that metastasis, that the death that usually come early, so that you can prolong your life, so that you can live your life, you can see your children and children to come. Yeah.
Okay, well. What a very informative session that we are having here on our Health Corner Show, and I understand that time is almost up for our discussion. As we wind up, there is call to action finally. Constantine, what would you love to share to the viewers as far as cancer awareness and prevention is concerned? What message would you love them to take away for this conversation and discussion today and cancer in general?
Thank you so much. Our viewers, at least you can testify like cancer is a monster, and then we can't deny, we say cancer is not there, cancer is there. But at the end of the day, we shall tell people we can journey together in terms of social thing, in terms of everything. So when you come to St. Mary's Mission Hospital, come we do our screening, come we do our palliative thing, come we give our chemo. So as early as possible, let's do our screening, let's prevent this monster, and once you have got it, just accept it. We are here to journey together. At least at the end of the day, we are going to prolong our life together. At the end of the day, we are going to work together. At the end of the day, we are going, like, maybe even if it reaches those times of end of life, you just may rest peacefully. So let's come together for screening. Let's prevent this monster. Let's kill this monster. And indeed, at St. Mary's Hospital, we can cure it.
All right. What a very insightful discussion that you've been having here on our Health Corner Show with Constantine from St. Mary's Mission Hospital, who is an oncology nurse. Thank you very much for shedding more light and for sharing this beautiful information about cancer. Thank you for making time as well. And I think my takeaway is that if cancer is early detected and prevented, actually, prevention and early detection is the key for cancer.
Sure.
So in case you have time, in case you hear St. Mary's Mission Hospital have this screening medical camp, please make sure you visit their branches. You have Elementator branches. You can also visit St. Mary's Mission Hospital here in Langata to make sure that you enjoy the services and get to know about your well-being. Because here at Capuchin TV, we say your health is your wealth, and we continue with this conversation every Friday to help you understand more about your well-being and to make sure you stay healthy and informed. Thank you very much to all of you who were tuned into our conversation, and I can hear Venanzi Nganga, you were following this conversation all the way here in Karen. Thank you very much, all of you, and to Capuchin TV crew who are behind the scene, starting with Marvaton. We have Peter Mwangi, we have Willie Mutua. Thanks to all of you for making this conversation a success, and thanks to St. Mary's Mission Hospital for sending a representative here to engage and inform and educate our viewers. Thank you very much. But for now, stay healthy and stay informed. My name is Maureen Kimani. See you next time, and God bless.
Enjoy this conversation with me, Maureen Kimani, every Friday from 9 a.m. on our Health Corner show here at Capuchin TV. Your health is your wealth. Feeling unwell? Seeking expert medical care that prioritizes both your health and well-being? Welcome to St. Mary's Mission Hospital, Langata, where compassionate care meets cutting-edge medicine. At St. Mary's, we believe in providing holistic health care. Our dedicated team of healthcare professionals is committed to delivering personalized care to each and every patient. Nestled in the heart of Langata, our hospital offers a peaceful and healing environment for patients to recover and thrive.
We have masses every day, weekdays at 6:30 a.m. in the morning and also in the evening at 6:30 p.m.
Your health is our top priority. Experience the difference with compassionate care you can trust. Whether you're in need of routine medical care, specialized treatment, or emergency services, St. Mary's Mission Hospital, Langata is here for you. We offer a comprehensive range of services including outpatient, inpatient services, laboratory services, comprehensive care clinic, MCH and maternity, ophthalmology, pharmacy services, radiology and sonography, dental services, pediatrics, physiotherapy, ICU and HDU services, dialysis.
Here we do dialysis for kidney failed patients, and we do it from Monday through Saturday. We welcome you all. We accept all insurances and cash.
Specialist clinics and CT scan services. Experience your health difference with us. Visit us at Langata or our branches in Nairobi at Cardinal OTUNGA PLAZA and in Rift Valley, Elementaita, Nakuru County. For more information, contact us at 97-972-94 or 0769-781-880. 0717-305-204 or email us at info@stmarysmissionhospital.co.ke. St. Mary's Mission Hospital, Langata. Compassionate in healthcare.